They are a waste of space. They will never amount to anything. Can't they see what they're doing to themselves? Do they even care about themselves or their family? These are things we hear often. Sometimes we see them on various social media platforms. Sometimes we see them on TV or maybe in our favorite TV show. These phrases are associated with the stigma of addiction. On the other side of addiction is a concept known as harm reduction. What is harm reduction? Is it new? Actually, it's not. When COVID-19 happened, many of us were sometimes forced to wear masks when we went out places, such as the grocery store or doctor's offices. Sometimes we even had to quarantine in our own homes and stay away from others. Why did we have to do this? It was to prevent us from the harm that could come if we caught the virus. What about in our everyday lives? Well, hopefully one of the first things we do when we get in our vehicle to drive somewhere is put on our seatbelt. Why do we do this? Well, we do this to prevent the harm that is associated with getting into a car accident. What though about the harm reduction concept when it comes to those who suffer from addiction and substance use disorder? By learning about the benefits of harm reduction tactics, we can see why this should be used in the treatment of substance use disorder. What is substance use disorder exactly, and why is it such a big deal? According to the Mayo Clinic, substance use disorder can be defined as a disease that affects a person's behavior and brain and leads to an inability to control the use of an illegal or legal substance or medication, which is basically alcohol or drug use. When it comes to drug use and alcoholism, there are many risks that are associated with it. Some of these include things like health risks, like heart attacks, strokes, lowered inhibitions, and it even can go as far as to being overdose and death. Drug and alcohol addiction touches more than just the life of the person who is using the drugs or alcohol. It also is a whirlwind effect on those around them that are close, such as family members, co-workers, and friends. By learning about the benefits of harm reduction, these allow positive changes to come about, not only in the person who is addicted or who is an alcoholic, but also the benefits that come to those around them. It helps us to see why using harm reduction for substance use disorder is important. One of the tactics that we will learn about for the harm reduction approach is MAT therapy. This stands for medically assisted treatment. Mainly those are things such as methadone, naloxone, and buprenorphine. For this, we will focus on naloxone and buprenorphine. The first one we will talk about is Vivitrol shot, which is naltrexone or naloxone. This is something that is specific to those who suffer from the disease of addiction when it comes to opiates. Usually when used in conjunction with things such as individual and group therapy, it allows the person to become to have a better chance at beating addiction. It also affects the brain receptors that are associated with addiction, and it helps reduce cravings and to help with withdrawal symptoms that are associated with it. The other form of MAT therapy, which again is medically assisted treatment, is known as Brixadi. This is a newer one, and this is strictly just the buprenorphine. This is also associated with those who suffer from addiction to opiates. And unlike things like methadone that sometimes may produce a high for the person, it does not produce that at all, and it also helps with the withdrawal symptoms and the cravings. According to the author Bjorn Johnson, buprenorphine contributed to a realization that it was possible for those addicts and alcoholics to actually achieve sobriety and engage in activities that weren't related to their substance abuse. A second harm reduction tactic we will discuss is abstinence. Abstinence is when a person refrains from something. For example, a person decides to be abstinent from drugs or alcohol. That means they've made that decision to not have those in their lives at all. Oftentimes, for people who suffer from addiction and alcoholism, it's hard for them to wrap their minds around being abstinent or refraining from using their drug or alcohol indefinitely. What, though, about the harm reduction tactic for them to reduce their drug use or drinking? Well, according to Julia DeTurney, she did a study on a 1-month abstinence challenge from alcohol. At the end of this challenge, there were many benefits that were associated, such as those who had lower drinking patterns, and then they had better psychosocial functioning. During this challenge, also, some of the other benefits included improved sleep patterns, weight loss, and having better clarity of mind. They're a waste of space. They will never change. Can't they understand what they're doing to themselves and the ones who love them? Upon looking into the concepts of harm reduction, which included the medically assisted treatment and the abstinence, these outcomes have both had good outcomes in the treatment of substance use disorder. By incorporating these things in treatment, stigma of addiction can be reduced, and they have a better chance of coming to the grips of their addiction and actually dealing with the problem that's associated with it. Without a doubt, the idea of harm reduction and treatment of substance use is very beneficial.